New tonight, West Coast states are responding to new guidance from the CDC reducing the number of vaccines recommended for children. The West Coast Health Alliance now warning the move risks increasing the likelihood of outbreaks of preventable and sometimes deadly diseases. Catherine Hook spoke with a pediatrician and parents about those changes. Catherine?
And David, federal officials suggest the changes meant to restore trust in public health lost during the pandemic. But some local doctors and state health officials say they stand by previous evidence-based recommendations. As parents picked up their kids Monday, the after-school lesson was all about vaccines.
It just feels like a little pinch.
The pickup line buzzing around the CDC's newly reduced childhood immunization schedule.
I will be vaccinating her as much as possible, both my kids.
Jennifer Hookstra says she's taking vaccine recommendations from her kid's pediatrician, which haven't changed.
It's concerning that all of these vaccines are being rolled back. It's not safe.
On Monday, the CDC rolled back 7 childhood vaccines, reducing the immunization schedule from 18 to 11. Gone from the list, vaccines for chickenpox, flu, COVID, RSV, hepatitis A, meningitis, and rotavirus. Some of those are still recommended for high-risk patients.
Wildly disappointed. I think that it is harmful to our communities and to the immunity that we need as a community to keep to keep healthcare costs lower and to protect our citizens.
My hope is always to keep kids healthy. That's my job as a pediatrician.
Dr. Clary Jerry is with Pediatric Associates of the Northwest, which follows vaccine guidance from the American Academy of Pediatrics. She says each vaccine is on the list for a reason. For example, RSV is the leading cause of infant hospitalization, according to the American Lung Association.
Those babies get really sick, and with the introduction of the RSV vaccine, we've seen huge decreases in kids getting that sick. And similar, rotavirus protects against a really bad diarrheal illness. So a lot of little kids get very dehydrated and end up in the hospital needing fluids. And those are real life impacts when you start peeling away those vaccines.
On Monday, the Oregon Health Authority said they too will keep recommending the AAP's vaccine schedule for children. They're also reviewing the announcement from Health and Human Services. Under their new recommendations, federal health officials say insurance will continue covering all children's vaccines, noting the change is more about offering parents flexibility and choice. David, back to you.
Thanks, Catherine. I appreciate your reporting there.